10 common medications that are dangerous and damage your kidneys. Are your daily medications secretly harming your kidneys? Today, we're diving into a topic that could change the way you look at your medicine cabinet forever. Recent studies have revealed a shocking reality. Many of the pills you trust could be slowly damaging your kidneys. Have you ever wondered why your doctor monitors your kidney function during routine checkups? It's because medications like pain relievers, antibiotics, and even heartburn drugs can lead to chronic kidney disease. Yes, the same pills you rely on for relief might be pushing you toward dialysis. Imagine feeling perfectly fine, only to discover your kidneys are failing. I've seen patients who ended up in the ER with severe kidney damage, all because of medications they thought were safe. Are you taking nonsteroidal anti-inflammatory drugs for pain? Or perhaps proton pump inhibitors for acid reflux? These could be silently wreaking havoc on your kidneys. What's even more alarming is that many of these medications are available over the counter. How many times have you popped a pill without thinking twice? The danger is real, and it's lurking in your medicine cabinet. Could your daily routine be putting your kidneys at risk? 1. Nonsteroidal anti-inflammatory drugs. Nonsteroidal anti-inflammatory drugs, commonly known as NSAIDs, are widely used to alleviate pain, reduce inflammation, and bring down fevers. Common examples include ibuprofen, Advil, Motrin, and naproxen, Aleve. While these medications are effective, they pose a significant risk to kidney health, especially when used frequently or in high doses. NSAIDs work by inhibiting enzymes called cyclooxygenases, COX-1 and COX-2, which are involved in the production of prostaglandins. Prostaglandins play a crucial role in maintaining blood flow to the kidneys. By reducing prostaglandin levels, NSAIDs can decrease blood flow to the kidneys, potentially leading to acute kidney injury, AKI. This is particularly concerning in individuals with pre-existing kidney conditions, dehydration, or heart failure. Chronic use of NSAIDs can lead to chronic kidney disease, CKD. The risk is heightened in individuals who use these medications for long-term pain management, such as those with arthritis. Symptoms of NSAID-induced kidney damage may include decreased urine output, swelling in the legs and ankles, fatigue, and shortness of breath. In severe cases, it can lead to nephrotic syndrome, a condition characterized by protein in the urine, low blood protein levels, high cholesterol levels, and swelling. To mitigate the risks, it's essential to use NSAIDs only as directed and for the shortest duration necessary. If you have a history of kidney problems, it's crucial to consult your healthcare provider before using these medications. They may recommend alternative pain relief options that are safer for your kidneys. Additionally, staying well hydrated and avoiding the use of multiple NSAIDs simultaneously can help protect your kidney health. 2. Antibiotics. Antibiotics are vital in treating bacterial infections, but certain types can harm your kidneys. Aminoglycosides, such as gentamicin and tobramycin, are particularly notorious for their nephrotoxic effects. These medications are often used in hospital settings to treat severe infections. Aminoglycosides can cause direct damage to the renal tubules, the structures within the kidneys responsible for filtering waste from the blood. This damage can lead to acute tubular necrosis, ATN, a condition where the kidney cells are injured and can no longer function properly. Symptoms of antibiotic-induced kidney damage include decreased urine output, swelling, and an increase in blood urea nitrogen, BUN, and creatinine levels, which are markers of kidney function. The risk of kidney damage from antibiotics is higher in individuals with pre-existing kidney conditions, the elderly, and those receiving high doses or prolonged courses of treatment. Other antibiotics, such as vancomycin and certain cephalosporins, can also pose risks to kidney health, particularly when used in combination with other nephrotoxic drugs. To minimize the risk, healthcare providers carefully monitor kidney function through blood tests and adjust dosages accordingly. If you're prescribed an antibiotic known for its potential kidney side effects, it's important to stay hydrated and follow your doctor's instructions closely. Reporting any unusual symptoms, such as reduced urine output or swelling, can help detect kidney issues early, allowing for prompt intervention and potential adjustments in your medication regimen. 3. Diuretics. Diuretics, also known as water pills, are commonly prescribed to manage conditions such as high blood pressure, heart failure, and edema. They work by helping the body eliminate excess salt and water through urine. Common diuretics include furosemide, Lasix, hydrochlorothiazide, and spironolactone. While diuretics can be very effective, they can also lead to kidney damage if not used correctly. The primary risk comes from dehydration and electrolyte imbalances, which can put significant strain on the kidneys. When the body becomes dehydrated, the kidneys have to work harder to filter blood and maintain electrolyte balance. This increased workload can lead to acute kidney injury, particularly in individuals with pre-existing kidney disease or those taking high doses of diuretics. Diuretics can also cause a decrease in blood potassium levels, hypokalemia, or an increase, hyperkalemia, depending on the type of diuretic used. Both conditions can negatively impact kidney function. Symptoms of diuretic-induced kidney damage may include fatigue, muscle cramps, irregular heartbeats, and confusion. To protect your kidneys while using diuretics, it's important to follow your doctor's dosage recommendations carefully and maintain adequate hydration. Regular monitoring of kidney function and electrolyte levels through blood tests is essential, especially for those on long-term diuretic therapy. If you experience symptoms of dehydration, such as extreme thirst, dry mouth, or reduced urine output, contact your healthcare provider immediately. They may adjust your medication or suggest additional measures to support kidney health. 4. Proton pump inhibitors, PPIs. Proton pump inhibitors are widely used to treat conditions like gastroesophageal reflux disease, GERD, stomach ulcers, and other acid-related disorders. Common PPIs include omeprazole, Prilosec, esomeprazole, Nexium, and lansoprazole, Prevacid. While effective at reducing stomach acid, long-term use of PPIs has been associated with kidney damage. PPIs can lead to acute interstitial nephritis, AIN, an inflammatory condition affecting the kidney's interstitial tissue. This inflammation can reduce the kidney's ability to filter waste and excess fluids from the blood. Symptoms of AIN include fever, rash, fatigue, and changes in urine output. If left untreated, AIN can progress to chronic kidney disease. Chronic use of PPIs has also been linked to an increased risk of CKD and end-stage renal disease, ESRD. The exact mechanisms are not fully understood, but it is believed that prolonged suppression of stomach acid can lead to changes in gut microbiota, increased susceptibility to infections, and alterations in kidney function over time. To minimize the risk of kidney damage, it's important to use PPIs only as prescribed and for the shortest duration necessary. For individuals requiring long-term acid suppression, regular monitoring of kidney function through blood tests is advisable. If you develop symptoms such as swelling, decreased urine output, or unexplained fatigue while taking PPIs, it's crucial to contact your healthcare provider. They may evaluate your kidney function and consider alternative treatments for your condition. 5. Lithium. Lithium is a well-known medication used to treat bipolar disorder and other mood disorders. It is highly effective in stabilizing mood swings and preventing manic and depressive episodes. However, lithium has a narrow therapeutic range, meaning the difference between a therapeutic dose and a toxic dose is small. This makes monitoring lithium levels in the blood essential. One of the significant risks associated with lithium therapy is kidney damage. Lithium can cause nephrogenic diabetes insipidus, a condition where the kidneys lose their ability to concentrate urine, leading to excessive urine production and thirst. Over time, this can result in chronic kidney disease, CKD. Symptoms of lithium-induced kidney damage include increased urination, excessive thirst, fatigue, and swelling in the legs and ankles. Long-term use of lithium can also lead to interstitial nephritis, an inflammatory condition affecting the kidney's interstitial tissue, similar to the effects seen with PPIs. Additionally, lithium can cause glomerular damage, affecting the tiny filters within the kidneys responsible for removing waste from the blood. To mitigate these risks, individuals taking lithium need regular monitoring of their kidney function through blood tests and urine analysis. Keeping lithium levels within the therapeutic range is crucial, and this often requires periodic blood tests to adjust the dosage. Staying well hydrated and avoiding medications that can further harm the kidneys, such as NSAIDs, can also help protect kidney health. If you experience symptoms such as excessive thirst, frequent urination, or swelling, it's important to contact your healthcare provider promptly. 6. ACE inhibitors and ARBs. Angiotensin-converting enzyme, ACE inhibitors, and angiotensin-second receptor blockers, ARBs, are commonly prescribed to manage high blood pressure, heart failure, and chronic kidney disease. Examples of ACE inhibitors include lisinopril and enalapril, while ARBs include losartan and valsartan. These medications work by relaxing blood vessels, reducing blood pressure, and decreasing the workload on the heart. While ACE inhibitors and ARBs are beneficial in many ways, they can also affect kidney function, particularly when first started or when dosages are increased. These medications can cause a temporary decrease in kidney function by reducing the glomerular filtration rate, GFR, which is a measure of how well the kidneys are filtering blood. This effect is usually mild and reversible with dose adjustment. However, in some cases, ACE inhibitors and ARBs can lead to more significant kidney damage, particularly in individuals with pre-existing kidney disease, dehydration, or those taking other nephrotoxic medications. Symptoms of kidney damage may include increased blood creatinine levels, decreased urine output, and swelling. To minimize the risk, healthcare providers typically start these medications at a low dose and gradually increase it while monitoring kidney function through blood tests. Staying well hydrated and avoiding NSAIDs can also help protect the kidneys while on these medications. If you experience symptoms such as decreased urine output, swelling, or fatigue while taking ACE inhibitors or ARBs, it's important to contact your healthcare provider. They may adjust your medication or explore alternative treatments to manage your condition safely. 7. Chemotherapy agents. Chemotherapy agents are powerful drugs used to treat cancer by killing rapidly dividing cells. While they are effective at targeting cancer cells, they can also harm healthy cells, including those in the kidneys. Common nephrotoxic chemotherapy agents include cisplatin, carboplatin, and methotrexate. Cisplatin, for example, can cause direct damage to the renal tubules, leading to acute kidney injury, AKI. Symptoms of cisplatin-induced kidney damage include decreased urine output, swelling, and elevated levels of blood urea nitrogen, BUN, and creatinine. Carboplatin, while less nephrotoxic than cisplatin, can still cause kidney damage, particularly at higher doses. Methotrexate, another chemotherapy agent, can lead to kidney damage by forming crystals in the kidneys, causing obstruction and inflammation. Symptoms of methotrexate-induced kidney damage include decreased urine output, back pain, and elevated blood creatinine levels. To minimize the risk of kidney damage, oncologists often monitor kidney function closely before and during chemotherapy treatment. Hydration is crucial as it helps flush the kidneys and reduce the concentration of the chemotherapy agents. In some cases, medications that protect the kidneys, such as amifostine, may be administered before chemotherapy. Patients receiving chemotherapy should be vigilant about reporting symptoms such as reduced urine output, swelling, or back pain to their healthcare provider. Prompt intervention can help mitigate kidney damage and ensure that cancer treatment can continue safely. 8. Antiviral medications. Antiviral medications are used to treat viral infections such as HIV, herpes, and hepatitis B and C. While these medications are essential for managing viral infections, some can cause kidney damage. Tenofovir, a common antiviral used to treat HIV and hepatitis B, is known for its potential nephrotoxic effects. Tenofovir can cause proximal renal tubular dysfunction, leading to conditions such as Fanconi syndrome, where the kidneys lose their ability to reabsorb essential substances like glucose, phosphate, and bicarbonate. Symptoms of tenofovir-induced kidney damage include excessive urination, muscle weakness, bone pain, and electrolyte imbalances. Acyclovir, used to treat herpes infections, can also cause kidney damage, particularly at high doses or in individuals with pre-existing kidney disease. Acyclovir can form crystals in the kidneys, leading to obstruction and inflammation. Symptoms include decreased urine output, back pain, and elevated blood creatinine levels. To reduce the risk of kidney damage from antiviral medications, healthcare providers monitor kidney function through blood tests and adjust dosages based on kidney function. Staying well hydrated is crucial, especially when taking medications known to form crystals in the kidneys. If you experience symptoms such as excessive urination, muscle weakness, or back pain while on antiviral medications, it's important to contact your healthcare provider. They may adjust your medication or recommend additional measures to protect your kidney health. 9. Contrast agents. Contrast agents, also known as contrast dyes, are used in medical imaging procedures such as CT scans and MRIs to enhance the visibility of internal structures. While they are essential for accurate diagnosis, contrast agents can cause kidney damage, particularly in individuals with pre-existing kidney disease or those undergoing multiple imaging procedures. Contrast-induced nephropathy, CIN, is a condition where kidney function deteriorates after the administration of contrast agents. The exact mechanism is not fully understood, but it is believed that the contrast agents cause a reduction in blood flow to the kidneys and direct toxic effects on the renal tubules. Symptoms of CIN include decreased urine output, elevated blood creatinine levels, and swelling. To minimize the risk of CIN, healthcare providers assess kidney function before administering contrast agents. Patients with reduced kidney function may receive lower doses of contrast or alternative imaging techniques that do not require contrast. Hydration is also crucial as it helps flush the contrast agents from the kidneys. In some cases, medications such as N-acetylcysteine or sodium bicarbonate may be administered to protect the kidneys. If you have a history of kidney disease or are scheduled for a procedure involving contrast agents, it's important to discuss your kidney health with your healthcare provider. Staying well hydrated before and after the procedure and reporting any symptoms such as reduced urine output or swelling can help detect and address kidney issues early. 10. Bisphosphonates. Bisphosphonates are medications commonly used to treat osteoporosis and other conditions that cause bone loss, such as Paget's disease and bone metastases from cancer. Common bisphosphonates include alendronate, Fosamax, risdronate, Actonal, and zoledronic acid, reclast. While bisphosphonates are effective in strengthening bones, they can also cause kidney damage, particularly with intravenous formulations like zoledronic acid. Zoledronic acid can cause acute kidney injury, AKI, and, in some cases, lead to chronic kidney disease, CKD. Symptoms of bisphosphonate-induced kidney damage include decreased urine output, fatigue, swelling, and elevated blood creatinine levels. The risk of kidney damage from bisphosphonates is higher in individuals with pre-existing kidney disease, dehydration, or those receiving high doses or frequent treatments. To minimize the risk, healthcare providers typically assess kidney function before administering bisphosphonates and monitor kidney function during treatment. Staying well hydrated and avoiding other nephrotoxic medications can also help protect kidney health. If you experience symptoms such as decreased urine output, fatigue, or swelling while taking bisphosphonates, it's important to contact your healthcare provider. They may adjust your treatment regimen or explore alternative medications to manage your condition safely. Regular monitoring of kidney function and following your healthcare provider's recommendations can help ensure that your bones remain strong while protecting your kidneys. Here are some recommendations to keep your kidneys healthy. 1. Stay hydrated. Water is your kidney's best friend. One of the simplest and most effective ways to keep your kidneys healthy is to ensure you're drinking enough water each day. Hydration is crucial for your kidneys because water helps remove waste products from your blood in the form of urine and keeps your blood vessels open so that blood can flow freely to your kidneys. Think of your kidneys as a sophisticated filter system. Just like any filter, it needs a steady flow of fluid to flush out the impurities efficiently. When you're well hydrated, your urine will be light yellow or clear. Dark-colored urine is a sign that you need more water. Aim for about 8 cups, 64 ounces of water a day, but remember that individual needs can vary. Factors like your activity level, climate, and overall health can influence your hydration needs. For instance, if you're sweating a lot due to exercise or hot weather, you'll need to drink more to make up for the fluid loss. Another critical aspect of staying hydrated is the timing and consistency of your water intake. Instead of chugging large amounts of water at once, it's better to sip water throughout the day. This helps maintain a constant flow through your kidneys, promoting continuous filtration and toxin removal. Also, be mindful of the types of fluids you consume. While water is the best choice, other beverages like herbal teas, milk, and fresh juices can contribute to your fluid intake. However, try to limit sugary drinks, caffeine, and alcohol as they can be dehydrating and put extra strain on your kidneys. So, make it a habit to carry a water bottle with you and set reminders if you often forget to drink water. Staying hydrated is a simple yet powerful way to support your kidney health and overall well-being. 2. Eat a balanced diet. Your diet plays a significant role in maintaining kidney health. Eating a balanced diet that includes a variety of fruits, vegetables, whole grains, lean proteins, and healthy fats can help protect your kidneys and improve your overall health. A diet rich in fruits and vegetables provides essential vitamins, minerals, and antioxidants that support kidney function. For example, foods like berries, apples, and citrus fruits are high in antioxidants, which help protect your cells from damage. Leafy greens like spinach and kale are packed with vitamins A and C, which are beneficial for your immune system and overall health. Whole grains like brown rice, oats, and quinoa are excellent sources of fiber, which can help manage blood sugar levels and reduce the risk of kidney damage. Lean proteins such as fish, chicken, beans, and legumes provide the necessary building blocks for muscle repair and growth without putting too much strain on your kidneys. However, it's essential to moderate your protein intake, especially if you have existing kidney issues, as excessive protein can increase the workload on your kidneys. Healthy fats, like those found in avocados, nuts, seeds, and olive oil, support cardiovascular health and can reduce inflammation, which is beneficial for kidney function. It's also crucial to limit your intake of sodium, sugar, and unhealthy fats, as these can contribute to high blood pressure, diabetes, and other conditions that can harm your kidneys. Instead of adding salt to your meals, try using herbs and spices to enhance the flavor. Also, be mindful of portion sizes and avoid overeating, as maintaining a healthy weight is vital for kidney health. Being overweight can increase your risk of developing conditions like diabetes and high blood pressure, which are leading causes of kidney disease. By focusing on a balanced diet, you can provide your kidneys with the nutrients they need to function optimally and reduce the risk of chronic kidney disease. 3. Exercise regularly. Regular physical activity is another cornerstone of kidney health. Exercise helps maintain a healthy weight, lowers blood pressure, and improves cardiovascular health, all of which are crucial for preventing kidney damage. Engaging in regular exercise helps keep your heart and blood vessels healthy, ensuring that your kidneys receive a steady supply of blood. When you exercise, your body works more efficiently to regulate blood pressure and blood sugar levels, both of which are vital for kidney health. High blood pressure and diabetes are the two leading causes of kidney disease, so managing these conditions through exercise can significantly reduce your risk. Aim for at least 150 minutes of moderate intensity exercise per week, such as brisk walking, cycling, swimming, or dancing. If you're new to exercise or have any health concerns, it's a good idea to consult with your healthcare provider before starting a new workout regimen. They can help you create a personalized exercise plan that suits your fitness level and health needs. In addition to cardiovascular exercise, incorporating strength training into your routine is also beneficial. Building muscle mass helps improve metabolism, supports joint health, and enhances overall strength and endurance. Simple activities like lifting weights, doing bodyweight exercises, or using resistance bands can be very effective. Don't forget the importance of flexibility and balance exercises, such as yoga or Tai Chi, which can help improve overall mobility and reduce the risk of injuries. Staying active doesn't necessarily mean hitting the gym every day. Find activities you enjoy, whether it's gardening, playing a sport, or going for a hike. The key is to stay consistent and make physical activity a regular part of your lifestyle. Regular exercise not only benefits your kidneys, but also boosts your mood, energy levels, and overall quality of life. Thank you for watching.